welcome to babyREADY. Today I was going to spend some time talking to you primarily about potential interventions and variations in labor, but I realized as I started recording the episode, it's a fairly intense and involved discussion. So today I'm going to focus more on the induction process. So getting labor started artificially, whether you're doing it for yourself outside of the medical facility or whether you're doing it with a care provider. So those are some of the things we're going to talk about today, but I think we'll wait to talk about other potential interventions or variations in labor for another episode so that I can dedicate the time I need to dedicate for today. So we're talking about inducing labor or augmenting, keeping labor going. Those are the topics for today. The first intervention that has a possibility of being introduced to you is the idea of induction, and that is artificially getting the labor started with the help of medical expertise. And there are a variety of different reasons as to why this happens. And typically, if we were sitting in a classroom setting, I would be asking you what you've heard of, because you all know someone who has had their labor started artificially, or at the very least had their labor artificially augmented or kept going. And that's not unusual, and it's not impractical. It just depends on the person and the situation as to why it's happening. The primary reason for induction is because the birthing parent is past their due date. The SOGC, or the Society of Obstetricians and Gynecologists of Canada, says that all birthing parents should have delivered their babies by the time they have 42 weeks completed gestation. And that is because the placenta functions most optimally in the first 41 weeks. It will slowly, and I mean slowly, lose its efficacy in its function beyond that time. And so they want everyone to be safe, and they put this directive in place for anyone who's catching babies, whether it's a midwife, an OB, or a general practitioner or family doctor. It is not uncommon to see the induction process started at 41 weeks and 1 day. That said, that is for anyone who's under the age of 35. But more and more often these days, I am seeing care providers, whether it is an OB, a GP, or a midwife, recommending induction before 40 weeks with increased age in the birthing parent. I have not myself read enough research about this to support the idea or encourage the support of the idea, but if it is something that your care provider is suggesting to you or recommending to you, it is something that I encourage you to have a full conversation with them about before the process is started. Being past your due date is definitely a number one reason why induction takes place. If you have gestational diabetes, that's another indicator that you will likely need to be induced, and that is really the only time that we get really worried about the size of the baby. All too often I hear people say that they need to be induced because their babies are too big, and I've been to births before where I have seen care providers putting their physical hands on babies and saying this baby is such and such a weight, and they're off by 1 to 2 pounds. The same with ultrasounds. So we use our best guessing and we use the tools at our advantage, but we don't always know how big your baby's going to be. But what we do know is that if you're eating well, you're staying active, you're healthy, you're having your regular care appointments with your providers throughout your pregnancy, then it is improbable not impossible, but improbable, your body will grow a baby that you can't physically expel. And that's because the bones of the head are designed to change shape so that the baby can elongate the skull and can come through the birth passage safely. But we do sometimes hear odd situations where babies keep getting bigger and bigger and bigger, and that's most often associated with gestational diabetes. So most of the time, parents who are experiencing gestational diabetes will have to be induced. If you have high blood pressure, and I had pregnancy-induced hypertension, I already have chronic hypertension. I spent the last several weeks of my first pregnancy on bed rest because of hypertension, and it was just a concern about being able to keep my blood pressure low enough to keep me safe. And so once I got to a point where they just didn't feel like it was easy enough to regulate, I was induced with my first child. Preeclampsia is different than pregnancy-induced hypertension. Preeclampsia is, it's almost as though your body is rejecting the pregnancy after a period of time, and it's treating it as if it's something it needs to protect you from. So you may see a rapid onset of edema, and I don't mean just a little bit of ankle swelling, but I mean all of a sudden ankles are very swollen, elevated blood pressure, spilling protein in your urine. So you'll often find that care providers want you to check your urine when you go for appointments, and that is to just use the litmus paper kind of testing for that. And they're watching for all of these signs that your body's just struggling with maintaining the pregnancy, and that may result in either an induction, or depending on the severity of the situation, moving directly to a cesarean section. And we'll talk about that later. If, we worry about big babies and we talk about gestational diabetes and big babies and things like that. However, it is not uncommon for us also to be equally concerned about babies that are small for gestational age. So when you go for your appointments and they wiggle their fingers in your pubic bone, and then they slide their hand across the top of the uterus to the fundal top, the top of the uterus, and then they measure that. They're measuring that to see that it is consistent growth. And typically, you'll grow about 1 centimeter a week through the pregnancy. But even if you've been growing a little slower or a little faster, what they're looking for above everything else is consistent growth. So if we're seeing that growth being normal for a period of time and then slowly falling off, then they may recommend doing an ultrasound to see how the baby's coping, and they may induce at that time. And what they call that is an IUGR, or an intrauterine growth retardation. The baby's not growing as quickly and as smoothly as they want it to be. So they may determine that the factors may be such that it's easier to have the baby on the outside versus having the baby on the inside. They can control the environment and the variables a little bit better with baby on the outside. So they may recommend an induction at that point. Twins is another one. If you're having more than one baby, you're having twins, and baby A's head down. If you get past 36 weeks or so, it's very common for care providers to recommend an induction, even with a vaginal birth. But it isn't always the case. So we said, induction, let's get the process started. And there are a variety of different ways to do that. But let's say you've been told you're being induced on Tuesday, and here it comes, we're gonna do it. Are there things that you can do ahead of time for yourself to try and get the labor process started? You've probably heard people talk about different things that will work for them. And I have a short list of things that may help get your body ready to go into the labor process. And there's nothing that I'm going to suggest that will put you into labor for sure. But it is something that may help get the process started, or at the very least, get your body ready to go into labor. We often hear about sex being effective in trying to get labor started, or or we hear that it can be effective, but then we dismiss it as being a myth. And the reason that sex can be effective is two ways. One, it's with an orgasm for the birthing parent, there's the release of oxytocin. And oxytocin is the hormone that tells the uterus to contract and gives us contractions and helps get the baby out. But more than that, if there is penile penetration and ejaculation, then the deposit of the ejaculate on the cervix acts as an irritant to the cervix. It causes the cervix to spasm, and it is the prostaglandin in that we use synthetically. If you hear somebody being induced with the gel or with the strip, then it's a synthetic version of the hormone found in ejaculate that's being used. So all things being equal, your body being physically ready, sex can work as a means to get the baby, get the labor process started rather. But there's no absolute guarantees with that, of course. Nipple stimulation does the same kind of thing. So if you take your nipples and roll your nipples between your index finger and your thumb, very gently doing that, that can help to release more oxytocin. Some expectant parents prefer instead to try using a breast pump. That's a great tool also for augmenting labor. So labor's gotten started, but it isn't really moving forward. So you use the breast pump for a little while to see if that can stimulate things. That's certainly an option as well. When we hear about things like foods you can consume, I think that spicy foods used to work many years ago, but we live in such a varied, diverse world now that most of us have a pretty varied and diverse palate. So our systems are used to being cleaned out by just the regular foods that we eat without us consuming things that are going to hyperstimulate the bowels. And the reason that bowel stimulation in general is a potential benefit to getting labor started is just simply because the rectal passage leans right up against the uterus. And so if you have the bowels spasming, that's going to irritate the uterus. And we start to get these chain reaction types of responses. Chain reaction responses are pretty normal with labor. Whether the water breaks and the baby's head comes down and starts to work on the cervix, getting the irritations happening, which chain reaction to the uterus contracting, whether it's prostaglandin, either in a synthetic or natural version, applied to the cervix, stimulating the cervix, making it spasm, irritating the cervix, by extension, irritating the uterus, that can work as well. There's a variety of different chain reaction type of responses. If you're looking for a bowel stimulant that perhaps you haven't heard of before or maybe new to you, then I would recommend trying pineapple core. It's usually the part of the pineapple we throw out. I get that. But instead, take the core that you usually would throw out and put that in your smoothies and stuff like that. Please wait till you're at least 37 weeks gestation to try this. We want to make sure that your baby is fully grown and developed before we try to do anything that might even remotely stimulate labor starting. But if your body is ready, if you're 37 weeks, the extra fiber from the pineapple core has been documented as being a bit of a bowel stimulant that may help. Consuming, I believe they say 4 dates a day can help also get the body ready. But there isn't a lot that you can just walk down the street, find, and consume to put you into labor. Your body's not designed to go into labor easily. It's designed to go into labor when it's ready. Outside of things that you can do for yourself that I've already mentioned, some of the things that you can do with alternative care practitioners include making the time to go and see a naturopath. I generally recommend that all expectant parents go to see a naturopath sometime in their second trimester, better right from the beginning, but by the second trimester, so that you can have a baseline conversation with your naturopathic doctor about different techniques they can utilize both to make you comfortable through the pregnancy, but also in getting your body prepared to go into labor and birth your child. So generally speaking, if you haven't seen a naturopath by 24 weeks, I would recommend doing so. And truthfully, even if you're 36 weeks and you're just hearing about naturopathic doctors now, I would recommend making an appointment to go and see one. They utilize a variety of techniques, whether it's acupuncture to keep you comfortable and to alleviate morning sickness and nausea through early labor, or through early pregnancy rather, just general aches and pains and comfort throughout. Some expectant parents find that their allergies are more involved and intense during pregnancy, so acupuncture can help with that, as can some of the natural remedies that a naturopath can prescribe, or homeopathic remedies that a naturopathic doctor can prescribe. But they also can use acupuncture and remedies to get your body ready to go into labor. And ultimately, that's the goal, right? We're trying to put your body into labor when it's ready, as close to your due date as physically possible, so that we can avoid other interventions if at all possible. Chiropractic medicine can do the same kind of thing. It can not put you into labor, but it can certainly create an environment within the pelvis that helps the baby become optimally positioned within the pelvis to help facilitate stimulation of your body going into labor, outside of needing any additional support or help with that. There are homeopaths and massage therapists, although most massage therapists don't prescribe or ascribe themselves to being able to help get your body ready. At least it helps the body be relaxed, and physically and emotionally prepared is as important as physically prepared. So emotionally prepared, muscularly prepared, being in a good relaxed headspace is all important, and massage therapy can certainly facilitate that. As I said, homeopathic doctors can help. There's all kinds of different ways. So if you're not sure and you're wondering, reach out to me. By all means, I always invite everyone to subscribe to the babyREADY YouTube channel. But we are also on Instagram. We're babyREADY LGBTQ. We're also on Facebook as babyREADY. And then you can email me babyreadylgbtq@gmail.com. So there's those options as well. Let's talk just very briefly about what some of the options are in terms of getting labor started once you are with your care provider. One of the techniques is a stretch and sweep, which is most often performed by midwives versus family doctors and obstetricians, but it certainly is not exclusive to midwifery patients to receive this technique. It is an insertion into fingers into the birth canal up to the cervix to try and stimulate the cervix with a cervical sweep of the membranes from inside. And that doesn't always work, but it certainly can sometimes stimulate the cervix to start to get itself ready for the labor process, so that once the hormones are released by the body to put you into labor, the body's more willing to receive them, and they've already done some of the work. They may use an artificial rupture of membranes. Let's say they do a vaginal exam. They find that the cervix is already starting to efface. It's starting to dilate. They may decide instead to use an amni hook, which is a long yellow apparatus. It looks sort of like a crochet hook. It is not anything to necessarily be frightened of. Fingers are inserted up to the cervix. Then the amni hook is slid along, and then there is on the underside there's a little hook of it, so that they would put that up against the amniotic sac and turn and pull just a small hole in the amniotic sac. Because there are no nerve endings in the amniotic sac, the process is potentially uncomfortable because of the fingers against the cervix, especially if there's some sensitivities there, especially if you've been laboring at all and you're a little bit uncomfortable. But in and of itself, there are no nerve endings there, and they'll make sure to avoid touching the baby with the amni hook. And because the hook's on the other side, it's not going to scratch or hurt the baby in any way. But let's say you haven't had your cervix soften, you haven't had your cervix start to thin out, and there's been no dilatation, then often what they'll do is use a synthetic prostaglandin, as I've mentioned earlier. And they do that sometimes as a gel that's applied to the cervix. Sometimes it's a piece of paper that's soaked in the hormone that's placed up against the cervix or beside the cervix, and then that medication slowly releases over time. Many parents that I've spoken to who've experienced the use of synthetic prostaglandin find that there is considerable cramping that occurs with it, but it is not labor cramping per se. It's just everything's hypersensitive and hyperstimulated at that time. But what the prostaglandin can do is soften the cervix and get it ready to open. It generally takes at least a couple of applications of synthetic prostaglandin to stimulate the body enough for labor to actually progress and move forward. So it is something that's done over the course of a few days. It's not a very quick acting technique. And part of the reason for that being something that's favorable by care providers is really and truly because they want your body to kick in and want to do the work for itself. So they're hoping that with a little prostaglandin that they will just stimulate your body enough to get the process started. And so that your body will step up and step in and move things forward without them needing to use any other interventions. If they have a timeline in mind, they've created a point of no return, either by using the prostaglandin a few times, we're getting close to your due date, we need to get things started, the cervix is ready, or if your water has broken and there's been meconium in it, and so we want to make sure that things move forward swiftly, or if we're needing to augment labor, it's been going and it's been happening, but now it's slowed down, either because it's been happening for a while, maybe because baby's head's not well applied to the cervix, or if you've decided to have a medicated birth and contractions have slowed down as a result of receiving that medication, like an epidural or something, then they may use synthetic oxytocin. Sometimes you hear it called Pitocin. Pitocin is just a brand name. Syntocinon is another brand name. But all in all, it is a synthetic version of the hormone that the expectant parent's body gives or creates when they're going into the labor process. As I said earlier, it's the same hormone your body releases with orgasm, and that helps to contract the uterus. That medication is continuously fed through an IV in the arm, and because it's a continuous feed of medication in your body, they will put belts on your belly, and they will want to maintain a constant opportunity to see how the baby's coping with the medication in your system. So they'll use an external pheno monitor attached to your body to listen and document how the baby's responding to the medication as it's being administered. And they'll start off slow and they'll gradually increase until your body's giving good, consistent contractions to help move the labor process forward. So that, because it's a continuous feed of medication, is a point of no return. We have decided we're in this process, we're moving forward, and we need those contractions to happen. So at the end of the day, the ways that you can get labor started outside of the home or outside of the medical facilities include sex, nipple stimulation, eating highly fibrous foods, keeping yourself active, seeking the care and support of an alternative care practitioner like a traditional Chinese medicine practitioner that does acupuncture, a naturopathic doctor, a chiropractor, a homeopath, a herbalist, a registered massage therapist, those kinds of things. talk to them, see what they have to say, see how they think they can help you. And then when we're talking about having labor started artificially within the confines of the medical community, we'd be looking at a potential stretch and sweep, an artificial rupture of membranes, use of synthetic oxytocin, or use of synthetic prostaglandin. Those are kind of the things that are most commonly used. If you have any questions or concerns, please make sure you reach out to me. And by all means, I encourage you strongly to have conversations with your care providers about the things that you want more information about as it pertains to your pregnancy and your birth. All right. I look forward to talking to you next time. I will try to get into a little bit more of other potential interventions and variations in labor, like vacuum, forceps, episiotomy, cesarean section. Not things to be frightened of, just things to be conscious of. All right. I look forward to seeing you next time, and don't forget to subscribe.